Hello, namaste, welcome back to our channel. My dear student, today's session about the fourth stage of labor. So before going to discuss about the fourth stage of labor, I would like to tell what is the meaning of labor. So labor is the events that occur in the female reproductive system, where there are the four stages of the labors are there. The first one is first stage of labor, second and third and fourth. The first stage of labor takes a place of complete dilatation. The second stage will take a place of complete expulsion of the baby, whereas the third stage of labor is complete takes a place of expulsion of the placenta. Whereas, so completion of this complete setup of the labor, the fourth stage of labor is complete observation of the mother and baby. Yes, so that is the thing we are going to discuss right now. So observation and examination of the woman, it takes a place of 1 to 2 hours for the fourth stage of labor. Let's see what are the things we need to observe. The first one is pain assessment. So with the help of the pain scale management, we must assess the level of the kind of whether it is mild and moderate, severe. So based on the categories of pain, we must go for management of the pain assessment. And next one is evolution of the uterus. Yes, absolutely. Once the expulsion of the placenta, once the expulsion of the baby, we must find out the normal or abnormality of the uterus. Yeah, so there might be the different kinds of the situation. Introvert of the uterus may be occur, so some kind of the uterine problem will be occur. In that case, we need to evaluation and examination of the uterus. And next one is inspection of the cervix as well as vaginal wall. Yeah, so once the expulsion of the baby, it may chance to get the tears and fissures of the vaginal wall. In that case, we need to go for examination and inspection. And next one is examination of the placenta as well as umbilical cord also. So these are the main elements we need to focus for examination of the fourth stage of the labor. So that is the thing. And next one is what kind of the complications we may see for the mother. The first top priority is a hypothermia. Yeah, once the baby is expelled, so the fourth stage of labor, you must find out whether the mother and baby, two peoples need to be check out the temperature. So if the temperature is below the normal, that will be called as hypothermia. So hypothermia is a common condition where we can observe for the fourth stage. That's what always keep the baby in the mummification and always keep the mother in the warm area. So that is the two things you need to understand. And also may chance to get the postpartum some kind of problem like postpartum that hypothesis and postpartum anxiety or postpartum this depression. This kind of the problems may observe. In that case, we need to find out the complete set of the fourth stage. And next one is very rare case we can observe the postpartum hemorrhage is nothing but PPH. So PPH is one of the abnormal condition where you can see the complete done of the third stage of labor. For the fourth stage of labor, you need to observe the secretion of the vaginal discharge. So the different kinds of the bleedings are there. If it is more than normal, that will be one of the conditions called as postpartum hemorrhage that we will discuss for the next session. So this is also you need to assess. And next one is once the complete examination of the mother, you need to go for examination of the baby. So what kind of the things you need to see? As I told you for the previous session, Apgar score is one of the scale to examination of whether the baby is normal or abnormal. So what kind of the elements you need to focus it? The first one is activity, the level of activity of the baby. So if it is normal, abnormal, it depending on the points we are giving. And pulse rate and reflexes, appearance, respiration. So this everything is called as Apgar score. So based on the score, we can give the level of the conditions. If the score is 0 to 2, in the sense the baby is very severe distress. If the score is 3 to 6, the baby is moderate distress. If the score is 7 to 10, the minimal distress. If the score is plus 12, the baby absolutely normal. In that case, if the baby is belongs to these categories, baby need to go for pediatrician for further reference purpose. And other than that, what kind of the things? The vital signs is very important for the monitoring of the mother as well as baby. As we know that vital signs is including temperature, pulse and respiration and blood pressure. And remaining things are the flexibility of the baby we need to see, the motion of the baby we need to see. And next one is measurements, nothing but anthropometric measurements. The head circumference must be the normal 35, and chest circumference must be 33. So if it is there, the values, the baby is the normal. The baby color must be skin reddish in color, that is a pinkish color is the normal, and recoil of the skin also we need to be see. And these are the measures, general measures we need to find out in the fourth stage of labor. And also this is the very important to find out the reflexes and all. So few kinds of the reflexes we need to find whether the baby is normal or abnormal. Why we need to check the reflexes? The reflexes is the thing which is deciding the whether neurological problem is there or not. So what it is telling? The first one is tonic neck reflex. The baby's the neck is turning normally, then it is called as there is a neck reflex. I mean tonic neck reflex is present for the baby. And next one is grasping reflex. So how the baby is holding something, so that will be called as grasping reflex. If the grasping reflex is there, the baby is neurologically fit. And next one is step reflex. Once the baby is in the standing position, so the movement will be the like stepwise, that will be called as step reflex. If it is there, the baby is absolutely perfect. Whereas sucking reflex is very important for the baby, because the baby need to be sucked for the nipple of the breast, then only the baby can take the breastfeeding. So sucking reflex is very important to check the soon of the delivery in the fourth stage of labor. That is one of the reflex. And last reflex is baby skin reflex. How the things with the help of some kind of the instrument, so drag on the heel of the leg, and once you are doing dragging time, so if the baby is giving some sort of movement, then the baby is having baby skin reflex. So this is a reflex. If the baby is having this kind of the reflex, the baby is absolutely fine. If the baby is not giving the movement of the leg, I mean heel, so baby is a little kind of the neurological disorder, then refer for the neurological doctor. So these are the reflex, and these are the things you need to find out for the fourth stage of labor. My dear student, so today's session I have discussed about what is the meaning of labor and different kinds of the labors, and especially I have discussed about what is the fourth stage of labor and what are the things we need to do for the fourth stage of labor, and reflexes and examination to be done for the mother and as well as baby. So that's about today's session, my dear students. I will discuss next session, so further session under the OBG. So until that, stay tuned. Please like and share and subscribe. Please don't forget to comment. So until that, stay tuned. Thank you so much, my dear students. Signing off.